Now it's time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. As we just heard from our coronavirus correspondent, South Korea's new daily COVID-19 infections topped 100,000 for the third day in a row on Sunday. And perhaps we could be seeing another six-figure day on this Monday as Omicron continues to run rampant through the population. The number of new cases has doubled in around 10 days, and experts warn it could soon be double what we're seeing now.
Most people who contract Omicron are being told to recover at home with medicine from their local pharmacy. For more, we connect to Dr. Alice Tan, internist at MizMedi Women's Hospital in Seoul. Good morning, Dr. Tan.
Good morning.
So, as we all know, the number of new infections is rising rapidly here in South Korea, but it seems like the number of people in the ICU beds are decreasing. So do you think South Korea's healthcare system is coping with the situation okay despite the situation?
Well, the sequence in metrics is always we see an increase in new cases first, followed by the number of hospitalizations that go up. Then we have ICU cases go up, and then unfortunately we see deaths increase as well. The bottom line is right now we are seeing an uncoupling in terms of the number of new cases versus cases in the ICU. But there are signs that a surge in ICU cases is imminent. Over the weekend, the number of current ICU cases surpassed 400. Again, this is the first time in a month that we've been in the 400 range. And also, over the last week alone, there have been more than 71,000 cases newly diagnosed who are age 60 and over. There's also evidence of strain already in the hospitals. Compared to 1 month ago, there are actually 5,000 more hospitalization cases, so people in hospital due to COVID right now than compared to 1 month ago. And we're seeing more and more healthcare workers call in sick because of COVID, more nurses and also doctors. So I'm very concerned that over the next few weeks, there may be a huge surge in ICU cases, and we may be in a situation where beds are lacking again.
Yeah, that's concerning when the doctors and nurses start getting Omicron indeed, because that's going to put extra pressure on the healthcare system. Now, despite this surge, the South Korean government last Friday decided to shift the goalpost somewhat in terms of the business hour curfews, pushing it up by 1 hour from 9 p.m. to 10 p.m. This is going to be in place for the next 3 weeks. Some experts believe this wasn't really the right decision. What do you think about it?
You know, on the one hand, if we expand business hours, that could actually lead to less crowding in indoor facilities in the evening hours. There is a potential of a beneficial effect. However, you know, we need to be mindful that we're still on the upslope of the Omicron wave. This may potentially be the deadliest wave so far in the pandemic for Korea, just as it has been for the United States. And my two concerns are that any loosening of measures right now could be premature. And since we are seeing a waning of vaccine effectiveness even after the third dose, we have just started our fourth dose campaign among the vulnerable. And so any increase in transmission because of loosening of measures could spell a more dangerous situation for the people who are most vulnerable in the community.
Now, Dr. Tan, given that the pandemic has been here for around 2 years now, small businesses have been having a hard time, you know, considering the restrictions and social distancing measures, and many are considering flouting them and staying open for as long as they want because their livelihoods are on the line. So, as a medical expert, where do you stand on this?
I understand the frustration. I understand that people are tired. But we need to keep in mind that this is a war. This is still a war that we are fighting against the virus. And the only way to prevail against an enemy in a war is to stay united. There can be no victory. There can be no winning if we start to fall apart amongst ourselves. I also want for people to remember that it's not just businesses and livelihoods that have taken a hit. Since the beginning of the pandemic, 10 doctors, 3 nurses, and 2 paramedical personnel have actually died in the line of duty in fighting against this pandemic. And so I would ask the public, everyone to, stay united. Everyone should get their booster shot, follow the regulations. And that's really the only way that we can get to the other side more safely.
Okay, in regards to the vaccination rate here in South Korea, we've reported on it many times that the country has one of the highest vaccination rates in the world, but still we're seeing day after day of 6-figure cases of mostly Omicron, we presume. Since these vaccines were developed during previous variants, do they actually offer any protection at all against Omicron? And if you are a vaccinated person and you contract Omicron, then recover, is it still necessary for you, considering you must have some form of natural immunity, for you to continue getting booster shots?
Right. I understand that so many people might be confused because we have achieved 86% population full vaccination. How could it be that we're seeing so many cases? Well, it's because vaccines have waned in terms of their ability to protect against infection. However, we should keep in mind, and this is very important, that vaccines still offer a high level of protection against severe disease and also against death. And so that is why we need to keep up with our vaccinations and also keep up to date. So anyone who has not received a booster, who is eligible, must get a booster. If you've had your full 2 doses and then you get Omicron, is that going to be enough of a natural booster to keep you safe against the next wave, the next variant? That remains to be seen. And so that's why the recommendation is, even if you've had natural infection with either Omicron or any of the previous variants, that you do stay up to date with your vaccination schedule. Of course, you should wait probably a week or 2 after you've recovered before you get your booster shot. But everyone should stay up to date, and having had previous infection does not exempt you from staying up to date on your vaccinations.
All right, we will keep that in mind. Thanks for making time for us, Dr. Tan.
Thank you.